Welcome to Health Professional Radio. I'm your host, Neil Howard. Thank you so much for joining us for another segment. In this segment, we're going to be speaking with Mr. Robert Crutchfield. He's joining us here as CEO of TeleHealth Solution to discuss the current state of telehealth. Welcome to Health Professional Radio, Bob Crutchfield.
Thank you, Neil. I appreciate the opportunity to join you today.
Well, CEO of TeleHealth Solution, what is your professional background and what is the mission of TeleHealth Solution?
So, Neil, I've grown up in healthcare my entire career, and prior to joining telehealth, I had over 10 years of experience as a general partner in an institutional venture capital firm, Harvard Growth Partners, where I led the healthcare practice. And prior to that, I worked for U.S. Oncology, built and ran their pharmaceutical services division that helped position us to sell the company to McKesson. And prior to that, I did build and grow work for Cardinal Health and startups on my own. So I'm a healthcare guy through and through. The mission of telehealth today is to close gaps in access to care where patients are the most vulnerable and exposed and need care the most. And for us, we're concentrating on the post-acute skilled nursing facility space, as well as critical access hospitals in rural communities.
Even if we haven't been sick, we all know that telehealth has exploded. The COVID-19 pandemic, of course, drove a lot of patients to their primary care via telehealth, and it proved to be very successful. In your opinion, what is the current state of telehealth?
So I think what COVID-19 did for telehealth was it took a modality of care that had been on the sideline for many years in terms of, provider integration. The Teledocs of the world that are consumer facing have done well, but integrating telehealth into a care continuum as a viable and real point of care where we're part of the care delivery model and the care workflows that are built around patients to give them the best possible care. COVID forced that. As before COVID, telehealth, particularly in the areas we work in the rural acute markets and the skilled nursing facilities, it was a subscription-based model where the facilities had a alternative care provider that they could access when they needed them most. And this was generally after a patient had an episodic event where they had declined to the state that we were brought in a last minute to try to treat that patient in place. Well, what we found is that by treating patients within the first hour or two of an episodic downward spiral, we're able to successfully treat patients in place 95+% of the time. So by integrating us into the care model and the workflows of the delivery of care, we can actually work in a collaborative way with the medical directors on the ground, the nursing providers in the skilled nursing facilities, as well as the patients and their families. And so I think that's what COVID has done for us. And then the other thing that's interesting is that people think of telehealth as a technology play. And that's partially true. We are a technology-enabled service provider, but we enter through a digital doorway with our providers the same way, the physical providers enter through a physical doorway. Once we're in the building and we're at the patient's bedside, the manner in which we deliver care virtually is very, very similar to the manner in which a physical provider delivers care at the bedside physically. So I think that's been another, interesting benefit of COVID is that people are actually seeing how well patients respond to virtual healthcare.
All of this collaboration that you're talking about in the virtual space among different entities within a patient's care, is this collaboration that either was not taking place prior to the explosion of telehealth or taking place in such a slow pace that patients weren't able to see any of the efficiency at that stage?
Yeah, I think it was a slow movement. You had adopters of telehealth who were more mature in their thinking around the value of telehealth. And then you had slow adopters who were, sort of living in a reality where the medical director on the ground who, comes into the building multiple times a week, but not every single day generally, the medical directors felt that telehealth was a threat. We're not a threat to the medical director. In fact, we're a benefit to the medical director because if we can treat patients in place, when the medical director comes in to do their rounding, the patient is in the building and is being treated where they most desire to be treated. So we're finding that by electronically linking in with, EHRs like PCC and Matrix, we're able to create, the notations, the care event notes so that the providers on the ground have clear documentation of what, the telehealth provider did during the medical encounters that they did while the medical director physically was not in the building. And it creates a sustainability of care that's very good for patients, and it closes gaps in access. So if a patient has to wait 24 hours, 6 hours, 3 hours for a doctor to return a page, that is incredibly valuable time for treatment to have been, provided to that patient. So it prevents, that downward cycle from being to the place where the patient can't be stabilized and they have to be sent to the ER. And if you want to avoid hospitalizations, avoid unnecessary ER transfers. That's the first place to start.
Prior to the pandemic, we were beginning to hear a lot of talk about distrust of healthcare providers, distrust in the medical system as a whole, especially among our seniors. With this combination of digital health innovation, remote patient monitoring, and more seniors choosing to age in place, what about home-based healthcare as a digital option, especially when it comes to trust of the physician?
Yeah, so I think most of the distrust has come from how difficult it is to get in to see a physician. Sometimes scheduling is almost impossible. And then you have to have transportation to get there if you're unable to drive. And then once you get there, you have long wait times in the waiting room. So I think, distrust and inconvenience are very similar, right, for patients. And so I think, and then the other thing is that access, right? A patient wants access to a provider when they need it, not when it's convenient for the provider.
Absolutely.
And so I think that's what telehealth does. Virtual healthcare allows us to reach a patient in less than 3 minutes generally. So we can move through time and space through technology enablement very efficiently. And so I think you're absolutely spot on, Neil. I think that the future for patients who want to age in place is going to be virtual healthcare. I have a mother who is in the mid-80s, still blessed to be working. She drives. She practically, behaves like a 40-year-old. But at some point, I'm not able. I live in a different city from her, so I'm not able to monitor her health. Telehealth is going to give me the ability to be able to engage with my mother, work in concert with a provider, so that if I see declines in my mother's condition, I'm going to bring her provider in for an evaluation. Same token, if my mother wakes up and has a sinus infection or the flu, she can reach her provider through a virtual, digital doorway and be treated at home. The scripts can be delivered to her door if she needs them. So yeah, I think home-based care, the capability is here today, and it's happening at a smaller level. But I think you're going to see an explosion of that as the baby boomers continue to age and get older and want to age in place.
Bob, it's been a pleasure speaking with you. Give us a website where we can learn more about TeleHealth Solution.
Happy to do that, Neil. It's www.telehealthsolution, no S, telehealthsolution, singular.com.
Well, as I said, thank you so much for joining us here, and I'm hoping that we'll have another conversation in the future.
Thank you, Neil. I enjoyed it.
You've been listening to Health Professional Radio. I'm your host, Neil Howard, in conversation with Robert Crutchfield, healthcare veteran and venture capitalist, now CEO of TeleHealth Solution. Audio copies of this program are available at hpr.fm and healthprofessionalradio.com.au. You can also subscribe to the podcast on iTunes, listen in, download it SoundCloud, and be sure and subscribe to our YouTube channel at youtube.com Health Professional Radio.